The World Health Organization is set to officially declare Nigeria to have eradicated polio, having gone for more than 3 years without a case of the disease. The road to eradicating this child killer disease has been long and difficult. Correspondent Larry Adeyemi reviews efforts that led to ending polio in northern Nigeria.
When I was at the 5H, so the thing happened to me.
It is better imagined than experienced. After carrying a pregnancy for 9 months, birthing and nursing a healthy child, then all of a sudden, the child is stricken by an incurable disease and the child's life is forever changed. Yes, it was a global disease, but children in northern Nigeria suffered more. In 2012, Nigeria accounted for half of that year's global cases. From Katsina to Kaduna, Sokoto to Maiduguri, polio has broken more lives than can be counted, and the tears it has cost are yet to stop flowing.
Someone to find himself in such condition is not easy. So from the house, there's discrimination. Even in the family, I grown up, some they will not trust in me because they know say I'm facing challenges, this and that. Even though they spend on me, I could not be able to help others. So that's the world view, not in the family, in every society too. They look down on person living with disability.
Thankfully, Nigeria can now celebrate that polio itself has been stopped. But the road to eradicating polio was rough. The journey brought together partners from across the globe. A lot of money was spent, countless hours of labor, and untold sacrifices. It was achieved with the sweat, tears, and blood of thousands.
There were several processes and stages that we passed through. The last one was the African Regional Committee or Council on the declaration of the polio-free status. They were here just before the COVID-19 pandemic.
Some disabled children, we used to go around with them so that to show the people the danger of leaving this polio to them. So by them, they quietly accept the polio eradication program.
Now, Nigeria is in a celebratory mode with the official declaration that the country has conquered polio. However, health workers are urging caution. They do not want the country to get too comfortable yet. They want increased effort at vaccinating children. After all, dozens of other child killer diseases are still out there.
Children that died as a result of vaccine preventable diseases, they are so enormous. And so encourage every mother, every parent to at least accept the vaccine.
Person like me now, after I was affected with it, and I know what I'm facing, if I go out, I told the people that this what's happening to me as a result of this polio. If to say I took vaccine and it will not be able to happen to me like this, I believe all people will follow.
It is okay to celebrate eradicating polio in Nigeria, but speaking with Mogajime Gary, it shows that the victory is coming a little late, as so many lives have been irreparably damaged. Other vaccine-preventable diseases such as measles and tetanus are still out there and must be eradicated. Nigeria needs to stop the needless, preventable death of children. Larry Adeyemi, TVC News, Gombe.
The World Health Organization has certified Nigeria a polio-free country after 3 consecutive years of not recognizing or recording any outbreak. This was disclosed via the verified official Twitter handle of the World Health Body, WHO Nigeria. Nigeria will announce this today at a ceremony in Abuja. WHO said that the disease was at the moment endemic in only 2 countries, and that is Afghanistan and Pakistan, thereby bringing the world one major step closer to achieving the goal of ending polio anywhere in the world.
Dr. Faisal Shuaib is the Executive Director and CEO of the Nigerian Primary Healthcare Development Agency. And I would say congratulations on Nigeria's polio-free certification. This is a very important milestone in global health. Now take us through how Nigeria arrived at this desired destination.
Thank you very much for having me. The polio eradication story of Nigeria is really an amazing picture, an eclectic picture of different colors, of different levels of absolutely incredible human endeavor that looks at the leadership provided. I look at it from the resistance, the resilience of the human spirit. It's also a program of data utilization for evidence. It's really an amazing story that it will be incredible to tell all Nigerians. So here we are. We made so many efforts over the last 20, almost 30 years to eradicate this virus. But I would like to think that the most critical aspects of this journey have been those of leadership. Leadership at the most critical points. So for example, in 2016, President Muhammadu Buhari really shone through, making sure that we got to this place. So really this polio eradication certification is a story of how, when we needed it most, the political leadership was there. In 2016, you may recall that we had a setback. We went almost 2 years without a single case of white polio virus in Nigeria. When we did have 4 reports of white polio viruses in Borno State, a lot of people felt really, really bad. But when the Mr. President was given the report by the then Minister of Health, he really rallied the troops. He asked us not to give in to despair. He made available almost 30 million US dollars at that point and say, go look for more viruses, but make sure that you do not allow this outbreak spread beyond the borders of Borno State. Now, that leadership that was shown then is what has trickled through the years, and we find ourselves in a position where we can be proud of the work that we have done. But the leadership has not been only at the presidential level, it has been at different levels, at the level of the Ministry of Health, at the level of the National Primary Healthcare Development Agency. But a very critical leadership has always been on the part of philanthropists such as Alhaji Aliko Dangote, Mr. Bill Gates, the Global Polio Eradication Initiative, our development partners, WHO, UNICEF, the US Centers for Disease Control, USAID. A lot of our partners and donors really coming together, making sure that we're focused on finishing the job. It was also about leadership from the traditional leaders, particularly the Northern Traditional Leaders Committee on Polio Eradication and Primary Healthcare, led by His Eminence, the Sultan of Sokoto. There was leadership provided by the late chairman of the NTLC, the Shehu of Bama, and the leadership provided by the Emir of Argungu. All of these were very, very critical at different points in our polio eradication journey. So you might recall there was a time in the mid-2000s where there was this resistance to polio eradication because of the suspicion that oral polio vaccine led to infertility. So the traditional leaders and a large number of our leaders came forward, made sure that there was right communication, there was proof that oral polio vaccines do not cause infertility. That took a lot of leadership. There was a lot of leadership also provided by the Nigerian military, because part of the reason why we actually spent an additional number of years after the progress we made in 2010, 2011, and 2012 was because of the insecurity. So the Nigerian Army actually held the polio eradication program in the hand and made sure that we were able to make inroads into areas that were inaccessible due to the insurgency. So this is where the Chief of Army Staff really provided leadership, making sure that his troops were there with the program, providing a package of health services. So it wasn't just vaccinations. We weren't going to these communities with only oral polio vaccines, right? We went there with a package of health interventions against malaria, against diarrhea, against pneumonia, especially all of those communities that did not have all of this regular access to health interventions. So the leadership was really, really strong. But beyond the levels, the high levels of the leadership, the governors They contributed so much in terms of being there, speaking in favor of vaccination, making sure that they made the resources available to the frontline workers. And this is where the frontline workers, seeing the leadership provided by the governors, the commissioners of health, the executive secretaries, also went from house to house, making sure that no child was left behind in giving all the vaccines that were required.
Dr. Faisal Shuaib, Executive Director and CEO, Nigerian Primary Healthcare Development Agency. Well done, and congratulations once again, and wish you the very best as you continue in this critical task of ensuring Nigeria remains polio-free and improving access to healthcare at the primary level. Thank you very much for your time on the program.
Thank you very much. It's been an honor and a privilege.
Thank you, sir.